Hello, how are you doing? My name is Catherine. I'm going to be inserting a catheter to you today. Can you please confirm for me your name and date of birth? He says yes. It's confirmed by his wristband. Do you have any allergies? He says no. Okay. Are you having any pain today? He says no. Okay. So before we get started, I'm just going to perform some hand hygiene. Okay, I'm going to put on some clean gloves. Sometimes the gloves are nice and tight. Okay, Mr. Jones, this is only going to take about 15 minutes. Again, I said it's a catheter, and I just wanted to thank you for coming here today, since you have a choice on where you can go, so we really appreciate you coming here. You're going to place a pad under the patient. So we're going to put a pad under the patient. Doesn't have to be a sterile pad because we're going to clean him first. So, okay, Mr. Jones, I'm going to clean you with some soap and some warm water. He says, okay. Soap, warm water, soap, warm water. Okay. Gloves. We're going to perform some hand hygiene again because we like clean hands. As I'm doing my hand hygiene, I'm going to verify the order just to make sure that we have the right patient, right time, right medication. We've checked everything. Okay. He's not in any pain. Mr. Jones, are you sure you're not in any pain? And he says no. Okay. So we take our kit. This is our catheter kit. We want to first look at the expiration date just to make sure that it's not expired, and it's not. So we can get started. We open it up. Touching just the outer edge of everything just to make sure that we don't contaminate anything and that we have a sterile feel. So the gloves, we're just going to touch them from the very outermost edge, just like that. Just the outer edge. Open. Take the non-dominant hand. Touch only just the inside, the very outer ridge of the inside of the glove. Put it on your hand. Now you have a sterile hand. You can grab the other glove because now this hand is sterile, so you can touch the other glove. And again, you just touch the inside with this hand because it's not sterile. And pull that right over just like that. Okay, so now we have sterile hands. We want to keep everything above our waist. This is sterile, so we can put it here. Okay, Mr. Jones, I'm just going to drape you here. We're going to find the meatus, and we're going to drape Mr. Jones just like that. We now have a sterile dressing here. I'm going to put it right, place it right underneath him. Not going to touch his skin with it, just going to place it right underneath him. Okay, some swab sticks, we're going to open them. And lay them out on your sterile field. This, we can throw this away. So this area is all sterile. You can then take our lubricating jelly. Open it. And you're just going to put some in the tray because you're going to have to lubricate the end of the catheter about 3 inches. So once we have that in the tray, or trash over here, and then we're going to clean Mr. Jones. Say, I'm going to clean you. We're going to clean him. Remember, the foreskin has been pushed back, so we push back his foreskin. We're cleaning from the outside. This is now not sterile because it touched him. Throw that away. Second, a little bit further. Throw that away. Third, throw that away. Okay. Okay, Mr. Jones, you doing okay? All right, we're gonna get started. You're gonna take the catheter. Let's make sure that this part doesn't touch anything that's not sterile. We can add it here, just like that, because we have a sterile field here, a sterile field here. And 3 inches about of lubricating jelly. Make sure you get enough so that he's comfortable. And now attach this to the port. Okay. All right, it's attached to the port. And now we're going to advance the catheter. Okay, Mr. Jones, you ready? He says, yeah, I'm ready. Okay, we advance that port. Just keep going, keep going, keep going. When you get to the bladder, you're going to get some urine. Once you get some urine, you're going to advance 1 to 2 inches more. Then you have urine, you've advanced 1 to 2 inches further. You're going to pull back just a little bit to make sure that that's secure. And now that you know that it's secure, you're going to take and inflate the balloon with at least 5 mils, like that. Okay. You're going to open that port. You're going to secure it to the patient's leg. And then you're going to take the balloon or the catheter bag, you're going to put it below the bladder and hang it below the bladder on a secure place on the bed, just to make sure that you get proper flow. Not on the floor, on the side, secured to the side of the bed. Okay. Once you've done that, it's attached to his leg, it's secured to the side of the bed. Go ahead and finish cleaning up. Say, okay, Mr. Jones, is there anything else that I can do for you today? He says, no, I'm fine. Say, well, I'll be back to check on you. We're gonna go ahead and raise these side rails. We're gonna put his bed back as far as he needs, as far as what's comfortable for him. We're gonna document everything that we've done, because remember, if you don't document, it didn't happen. So we're gonna document what we have done. We're gonna take his call light and make sure that that's in reach. There you go, Mr. Jones. Thank you, and I'll be back to check on you.